I want to discuss two complications this afternoon, and this is what is known as a pelvic abscess and fistula. Well, or fistula because you are kind of like describing it differently, But pelvic abscess, of course, abscess is just accumulation of pus, right? The fistula, that's where you're now having abnormal connection of two structures, epithelial surfaces. So pelvic abscess is just a localized collection of pus in the cavity, while pelvic fistula is when there's abnormal connection between any pelvic organ, and another organ, or abnormal connection between the pelvic organ and the skin, which is on top. So let's discuss one by one. The abscess, which is collection of pus in the pelvis, this is fistulas. So abscess could be caused by a lot of things: pelvic inflammatory disease, post-surgical complications, ruptured ovarian cyst, diverticulitis, tubo-ovarian abscess, endometriosis, where you're having endometrial tissues, outside the endometrium. Alright, so symptoms is you're having a lot of pain, pelvic pain, fever, chills, and malaise. There's discharge in the vagina or the rectum, urinary urgency or painful urination. There's sometimes diarrhea and the person doesn't want to eat. So you diagnose it by a history taken, physical examination, images like pelvic ultrasound or CT scans, blood test. Treatments, basically the abscess are usually caused by bacterial infections, so use antibiotics. Then you can also drain the abscess. There's surgical interventions and all of that. So this is abscess, right? Collection of abscess. Then the fistula now. Fistula is abnormal connection between two surfaces that should not be connecting. So fistula is just an abnormal tract between two pelvic structures or a pelvic structure and the skin. So types could be vesicovaginal fistula. I just have it on this image. Please, you can pause to observe, right? So vesicovaginal fistula, bladder to vagina, rectovaginal fistula, rectum to vagina, enterocutaneous fistula, intestine to skin. So common causes could be due to injuries, pelvic surgeries, radiation therapy, Crohn's disease, cancers. So symptoms is you are not having abnormal leakage of stuffs, right? Because the connection is abnormal. So you diagnose it by dye test, you image too. Treatment, surgical repair, stomach creation, where you basically can divert urine or feces, to another place. Then antibiotics, because you want to prevent infections, or you want to treat infections that are already on ground.